Urethritis is also called urethra pain syndrome because the dominating symptom will be pain located in the urethra or lower bladder. There are two types of urethritis or UPS, urethra pain syndrome. One type has to do with sexually transmitted diseases such as gonorrhea, which causes an acute infection and acute inflammation of the urethra. This is usually quite easily treatable with antibiotics. Then we have probably the more common type of urethritis, which occurs after a urinary tract infection. Now, it can be a single urinary tract infection, or it can be repeat urinary tract infections during a shorter period of time, which triggers an inflammation. Here is the urethra and the bladder. The bacteria enter the bladder, and they trigger an inflammation which may affect the lower part of the bladder and the urethra. Now, this inflammation can become very persistent, and it can even take a chronic form. And it has this in common with other inflammations in the body. Inflammation is a good thing. We want an inflammation in the early stages of an infection because it helps the body to respond to the bacteria. But when the bacteria are gone, we would like to see the inflammation also disappear. Sometimes the inflammation will not disappear, and it can become a very long-term problem. Now what we believe happens is that the inflammation will affect the tissues around the urethra and the lower part of the bladder. When you do a cystoscopy, a camera examination of the bladder, most of the times you will not see anything because the inside of the bladder and the urethra will not be affected, but it's the tissues surrounding the urethra and the bladder which are inflamed. The diagnosis is often made by a simple examination where the patient has typical symptoms, and here we have the vagina and the uterus, where the doctor will place his finger in the vagina and simply push against the urethra and the lower part of the bladder, and that will trigger a localized pain. Treatment of urethritis is quite controversial because there is very little scientific evidence to guide us. Many times the doctor will start with anti-inflammatory drugs like ibuprofen. Usually when we use it here at my clinic, we will start with 4 weeks of intensive treatment, followed by 2 months of daily medications just to keep any positive effects going. When we have a patient with urethritis, the problem has usually arisen during a long period of time. This is rarely something acute. And we see patients after several months or sometimes years of symptoms. And when the inflammation has been that persistent, it usually takes a long time to get rid of it, if possible. There is one group of patients that will develop chronic urethritis, which is usually very difficult to treat. The next step in the treatment of urethritis could be to add antihistamine drugs. Histamine is a part of the inflammatory cascade, and histamine has an important function in inflammation because it recruits other cells to the inflammation and tells them that there is an inflammation going on, please come here. When we give antihistamine, we block this signal, and that can in turn decrease the signal, the inflammation. Also here, you have to consider a long-term treatment. If you believe that there is an infection going on, you might want to add antibiotic, of course. And to do that, I would recommend that you have a culture to guide you in your choice of antibiotics. Sometimes we add tricyclic antidepressants in patients with urethritis. The reason for this is that the old type of antidepressants, which are not used today to treat depression, also has a calming effect on nerves. What happens is that in a chronic inflammation, the nerves in the area will be affected and will become part of the problem. Sometimes these nerves also experience something called neuroinflammation. And by adding tricyclic antidepressants, you may slow the process down or decrease the pain. Urethral dilatation can also be used in the treatment of urethritis. This means that you place a metal instrument in the urethra. You gradually increase the size from 6 millimeters to 9 millimeters maximum. At the same time, you also place a cortisone and antibiotic ointment in the urethra. It is important that the patient does not go to pee immediately afterwards, because when you pee, the cortisone antibiotic ointment will be flushed out. Urethra dilatation is given once a week for 5 weeks. If the patient responds well, you may add monthly dilatations for 3 or 4 months after that, and you slowly decrease the number of dilatations performed during the year to come.